to this week's episode of Chatting with a Local Expert. I have with me today Mr. Craig Rodrigue from CSR and Associates. Welcome to the show, Craig.
Thanks, Brian. I'm really glad to be here.
So before we jump in, why don't you let the folks know what are some of the top services you guys offer there at CSR and Associates?
Sure. Here at CSR and Associates, mainly we write health insurance. So we do individual plans on healthcare.gov and off. We write Medicare plans. We do group insurance. So our main focus of our practice really is health insurance of all kinds. We even write unique items like MediShare, the Christian sharing programs. So if it has to do with health insurance, we handle it.
So anybody right now that has any health insurance questions be that an individual, a sole proprietorship, small business, medium business, large business, they can contact you and get lots of great information and help right now, right?
Absolutely. Sure can. Yes.
Yeah, that's awesome. Sounds like you guys offer lots of great stuff. I know you do. I have my health insurance through you for Brian Hurst Real Estate. So you guys do a great job for us. Thank you very much.
Thank you.
So, Craig, what would you say is the number one thing that sets you guys apart from others who sell health insurance? Because there's a lot of people out there doing it.
Right. And so the first thing I would say is I don't sell health insurance. I solve problems. And that sounds a little funny, but it's actually true. We're not here to sell you health insurance. I'm here to solve your problems. Sometimes that's with us. Sometimes it's not. Sometimes it's take your COBRA or your employer plan. So just today, I talked to a guy and had to show him why taking his group insurance at work was a much better solution. Our job really is just to solve the problem. And so we give independent advice. We'll tell you the best thing for you, whether we write health insurance or not. I've even had people on the phone with me and she, I'm trying to explain to her why she should take her COBRA. And she's, it's a 5-minute conversation of take your COBRA. And she's like, I know you're here to sell me health insurance. Well, actually, ma'am, I'm not. I just spent the last 5 minutes trying to convince you to take your COBRA. So that's the big separator for us is we're not here to sell health insurance, truthfully.
Hey, you're there to help people. So what are some of the benefits someone might receive from, hooking up with you guys right now?
Well, let's kind of talk about what's happening in the world with COVID right now. People are in a very difficult circumstances. So we have employers who have had to make difficult choices between laying people off or furloughing them and keeping the health insurance, and what options do they have? Do they have to pay those premiums or not pay those premiums? We're experts in the field, so whatever options those employers had, we help them work through that in terms of getting exceptions to not have to pay the premium right now while their business was closed, getting time to pay it so those employees can maintain their coverage. On the other side, we have employees who have been laid off from their jobs. They're having to decide the same thing, Brian. They're trying to figure out, do I take my COBRA? Is there another plan available for me? For a lot of those people, we're having conversations with them where they can get bronze plans that are even zero premium because they have this change in income.
Yeah.
Part of this is understanding what decisions you're making and why you're making them. And so when we have conversations with people, we want them to understand how subsidies work and what the risk is. We help them find their doctors, the hospitals, the medications, all of those things we do for them. And it's easy. We're the easy button. From the old Staples easy button.
Oh, yeah, absolutely. So obviously a lot of people can benefit from your services even more so now than possibly, just 3 months ago. What would you recommend is the right time for somebody to get started who, you got people who are furloughed, people who have been laid off, people who have been lost their job, been let go permanently. Like, who do you think, is the most vulnerable that could use your help right now?
Right. So we have a couple of interesting things happening. Number one, if people have not had coverage, maybe you never enrolled in health insurance this year, but now with COVID, you're thinking you really need it. We have some exceptions for them to be able to get coverage now. So number one, if you're uninsured and you need coverage, we can help you with that. Number two, just kind of back to what we were saying before, do I take the employer plan or the COBRA from work? Do I find something else? Is there a unique solution like MediShare that's available to us? We help people kind of figure out where should you be looking for your coverage. And a lot of this time, this is a 5-minute phone call to sort all of this out for people. So it's a very easy low pressure. We just help people resolve issues. And so I would say for anyone that has those kinds of questions, I need coverage. What do I do? Is my doctor covered? Is my medication covered? What happens if I go to the hospital? Insurance companies have done cool stuff, and so we'll have to talk a little bit about that too, just to give people some interesting information about COVID things that have happened. If you have a minute, I'll go through that now too.
Yeah, go ahead.
All right. So on the COVID side, there was a question all along from people and the insurance companies. What if I go get COVID testing? That's now covered at 100% by the health insurance plans. What if I have to go to the doctor? Well, that's covered at 100%. Gosh, what if I get admitted to the hospital? I would still owe my deductible and my co-insurance, maybe $3,000 deductible, $5,000 max out of pocket. If you actually have a COVID admission to the hospital, the insurance companies, most all of them are now saying you would have no co-pays, no deductibles, no max out of pocket. It's incredible. So for the people that are worried and thinking, I can't go to the doctor, I can't afford to be tested or even get the antibody test, all these things are covered at 100% if it's COVID related.
So
it's been an incredible experience.
So even with, I got an email from Quest the other day saying I could go in and get an antibody test. That would be covered as well?
Yes, on your health insurance plan, more than likely that's covered at 100%. All the carriers have a little bit of, maybe there's some variance there, but we can help people sort that out if they call us and just want to know, I'm on this plan, is this stuff covered or not? How about Teledoc? All the carriers now are covering the Teledoc and adding that to the plans, which is really nice. Teledoc is not what a lot of people thought. I can call the doctor on the phone, go through everything. They'll even prescribe medications and call them into the pharmacy. Had a terrible earache about 2 weeks ago. Did the Teledoc visit at my office, never left, talked to the doctor, went by and picked the medication up on the way home from the pharmacy. I didn't have to sit in the doctor's office for hours. So there's a lot of cool stuff and innovation that's been happening in healthcare as a result of this.
So was that calling your doctor or a different doctor?
Great question. In this case, I was calling a Teledoc, think like an 800 doctor, right? But I have medical practices that we write the insurance for that have converted their doctors to Teledoc doctors, and you are literally calling your doctor on the phone, and they're setting appointments just like they would as if you were going to see him. He'll call you back at 3 o'clock today, and your doctor's calling you back with all your medical information.
Gotcha.
That's great for prescription refills, some diagnosis stuff, because they have all your medical records.
Yep, absolutely. Well, that is great information there, Craig. What is the best phone number that folks can reach you at?
We can be reached at the 407-937-2900.
Perfect.
That's it all.
Yep, I'll include that number and also your business email when this goes out. So thank you for joining us for this edition of Chatting with a Local Expert. I would like to thank our special guest, Mr. Craig Rodrigue, for joining us today. Craig, thanks so much.
Thanks, Brian. You have a great day.
Yeah, man. So join us next week. We'll have a different episode of Chatting with a Local Expert. My name is Brian Hurst with Berkshire Hathaway Home Services. Stay safe, stay healthy, and we will see y'all next time.
Bye-bye.